People turn to our specialized rehabilitation care for many different medical conditions. As a patient in our hospital, you're taking an important step in your journey to getting back to being more independent. Because this shared goal is unique in rehabilitation, you'll find care here to be quite different from what you've experienced in a traditional acute care hospital or other care settings. Here, you'll feel much more involved in your own care and the progress that you'll make toward your goals. We know you've made the right choice, as rehabilitation clinical research shows that patients who undergo inpatient rehabilitation following a serious illness or injury can improve their functional outcomes and quality of life. Offering a higher level of care, we can help you reach your goals with comfort, professionalism, and respect. We know you're ready to get started and probably have questions about what to expect. Rest assured, we will address any concerns you or your family may have during your visit, all the way through discharge. Speaking of discharge, you'll be glad to know we began planning for yours even before you arrived. It's important for us to know your goals and the things you feel could be barriers to your discharge plan early in your stay. You are an important part of your recovery and an active part of making progress happen. Your comfort is one of our primary concerns. Please let any of our staff know if you are in pain, hungry, thirsty, cold, warm, or uncomfortable in any way. This helps us ensure your comfort during your rehabilitation experience. When packing for your stay, be sure to include loose-fitting, comfortable clothing for easy mobility during therapies. Also, bring toiletries and any prescription items like glasses, hearing aids, or dentures. You will be provided a notebook, which is designed to answer specific questions about our hospital and your care. We call it the With Notebook, and you'll bring it with you to therapy sessions while you're with us, and take it with you at discharge to stay on track with your goals. The first step in reaching your goals is meeting members of your rehabilitation team. The team is here to guide, encourage, and inspire you toward success. Following admission into our hospital, you can expect a visit from your case manager. This is your team link, making sure your treatment plan is coordinated and you and your family are updated on your progress. This keeps everyone on track with the discharge date and discharge plans. Your team includes registered nurses who are available 24 hours a day to answer questions, manage your medical care, and help you with pain management. Remember, physicians write prescriptions for patients, so nurses can give pain medication as needed. Always tell your nurse if you are in pain. It may take up to 45 minutes for medication to work, so never wait too long to ask. Also, please know that your safety is our top priority. Until we know you are safe to move about your room alone, always ask for help when you need to move from your bed or chair. This will help you remain safe and accident-free during your stay with us. Remember, call, don't fall. Your physician, specializing in physical medicine and rehabilitation, also plans to see you soon after you arrive to evaluate your condition. After that, you'll be visited by your rehabilitation physician at least 3 times a week to consistently monitor your progress and update treatment as necessary. If needed, your rehabilitation physician consults with other physician specialists during your stay to make sure all medical needs are met. A pharmacist, who manages your medications throughout your stay, can schedule a time for you and your family or caregiver to answer questions regarding your medications. A dietitian may need to work with you on your dietary requirements and restrictions. As they are available, we welcome family and friends to visit. They are an important part of the team and play a crucial role in supporting you and helping you reach your goals. Please encourage them to join you for therapy sessions. The next step is to begin your rehabilitation. To get your individualized plan started, therapists will evaluate your level of function and focus on your goals. It is an important part of the rehabilitation program to share your goals with your treatment team. Rehabilitation hospitals are required to provide at least 3 hours of therapy 5 days a week. It is also a requirement for you to participate in therapy and make improvements throughout your stay as a result of your therapy treatment. Therapy includes group and one-on-one sessions, which may be modified throughout your stay based on your individual tolerance and to help you meet your identified goals. Under certain circumstances, therapy sessions may fall on the weekends. Your physical therapist will help you improve your balance, endurance, and strength, which will help you to improve body movements. In physical therapy, you will work on skills, including getting in and out of a bed, chair, or car, walking, and climbing stairs. An occupational therapist will help you improve endurance, balance, and strength, and help you relearn how to care for yourself. This includes dressing, personal hygiene, cooking, shopping, and other activities which are meaningful to you. Depending on your treatment plan, a speech therapist can help you improve your speech and language skills, thinking skills, and swallowing difficulties. Your treatment team may include a respiratory therapist to help you with any breathing-related issues. Therapy schedules are given to you daily by our hospital staff. On occasion, schedules may change, which will also be communicated to you. Once you're following your therapy plan, how do we know you're on track to meet your goals? Team Conference. A team conference occurs once a week. This is a meeting led by your rehabilitation physician, and all of your treatment team members attend. They discuss your progress, estimate your discharge date, and plan to resolve any barriers in the way of your discharge plans. After each team conference, your case manager will meet with you and your family to discuss the results of the team conference and update you on any changes to your plan of care and ask you for any input. These team conferences are used to help set new goals as you conquer small ones to ensure progress. Things like getting in and out of a chair, in and out of bed, putting on socks and shoes, cooking an easy meal, and remembering a therapist's name can be the building blocks that get you where you want to be. After all the hard work comes your discharge day. Discharge planning begins on the first day of your stay. As previously mentioned, your case manager has been keeping you and your family updated on your progress. Please ask if you or your family members have any concerns regarding your discharge instructions. In the final days of your rehabilitation stay, therapists may recommend equipment you may need upon discharge. Your rehabilitation physician reviews the medications you'll need when you leave the hospital. All of your follow-up needs are planned for prior to discharge, so you are ready to go with confidence. When you leave, you will want to take your with notebook along for the ride, so you may refer to it after you are discharged. The With Notebook offers helpful information on what to expect once you are at home. Before you leave, take a minute to go over it with your nurse, therapist, or case manager in case you have any questions. Within a few days after discharge, someone from our hospital will call to make sure your discharge has gone smoothly and see if you have any questions or concerns. You may be contacted to complete a short survey. Your feedback is important in helping us improve our patient experience and lets us know what we're doing right. We would like to know the things that were positive about your experience and any comments you may have for improvement. We are committed to being the best rehabilitation provider for our patients by providing comfort, professionalism, and respect to every patient. If you have any questions or need contact numbers for your team members, please ask your case manager. Again, thank you for choosing our hospital for a higher level of care.